Yes. Hi to everybody and welcome to the live webinar on cancer prevention, myth or fact. This webinar is presented by Dr. Sneha Kommineni. In today's complex healthcare environment, patients often struggle to find answers they can trust. That's why Spashta Healthcare came into picture, a place where compassionate care meets transparent communication, and every patient is treated with respect, honesty, and empathy. We are conveniently located at BTM layout near Bannerghatta Road. Our superspeciality OPD clinic brings together leading consultants in cardiology, oncology, endocrinology, fertility, and ophthalmology for the moment. Each department is equipped with modern diagnostics and led by experienced specialists. We are committed to evidence-based treatment. So whether you're seeking preventive screenings, managing conditions, or navigating complex health conditions, we are offering guidance to you and you can count on us, not just now, but at every step of your journey. Spashta Healthcare is proud to be a trusted neighborhood clinic for families across South Bangalore. And more than just treatment, we offer a healing environment where clarity, confidence, and personalized care comes first. For today's webinar, I'm your host, Mansi. Here's a brief introduction to all the doctors at Spashta Healthcare. If you're looking at healing or any questions and queries when it comes to type 1 and type 2 diabetes, thyroid disorders, obesity and metabolic syndrome, pituitary and adrenal disorders, osteoporosis, we have with us Dr. Varun Suryadevara, an MD, DM, consultant endocrinologist and diabetologist. He comes with extensive experience in diagnosing and managing a wide range of hormonal and metabolic disorders. He's committed to delivering patient-first, evidence-based care for long-term health. Welcome, Dr. Varun. Also, if you're looking for angioplasty, coronary angiogram, permanent pacemaker, leadless pacemaker, structural interventions, just about anything to do with cardiology, we have our consultant, interventional cardiologist, Dr. Praneeth Suryadevara. He comes with extensive experience in diagnosing, treating, and managing a broad spectrum of heart condition. Welcome, Dr. Praneeth. If you're looking at IVF, IUI, PCOS, endometriosis, then we have with us Dr. Keerthana Ravipathy. She's a gold medalist in and an MS VG FNB. She is the consultant reproductive medicine specialist at Spashta Healthcare. She comes with an extensive experience in diagnosing and treating a wide range of fertility challenges. Welcome, Dr. Keerthana. Thank you all the doctors for joining today. I'm not sure if Dr. Shravani from ophthalmology is here. Welcome to you too, Shravani, if you're here. Before we start, thank you to our technology platform partners, that's Cipla, for having put this together for us. When we all sat together and brainstormed on the increasing cases of cancer in our society, there were a couple of questions that kept haunting everybody. Today, things like, why are children getting cancer? Is plastic really the cause of cancer? Does non-stick utensils cause cancer risk? Is eating tandoori or burnt food harmful? Does consuming non-vegetarian food lead to cancer? Can fasting prevent cancer? Does drinking and smoking really cause cancer? I mean, what else can cause cancer? Is it genetic? Is it communicable? There are so many questions. And when we started to think of why is there so many questions in people's mind, we realized, thanks to social media, too many people have said too many things, causing enough confusion, and this is causing unnecessary fear among the people. To dispel this fear today, we have with us Dr. Sneha Kommineni, our lead medical oncologist. When it comes to cancer, whether you're looking for screening or vaccination, diagnosis, treatment planning, chemotherapy, oral chemotherapy, intravenous chemotherapy, target therapy, immunotherapy, follow-up, survivorship, we have one-stop shop at Spashta Healthcare, which is Dr. Sneha Kommineni. She's our resource person for today. She's an MD and DNB SE from UK. She's our consultant medical oncologist. She has got extensive experience in diagnosing and treating a wide range of cancer. She's committed to delivering evidence-based, personalized care to each patient. She's very well known for her patient-centric and compassionate approach, ensuring that every individual receives thorough, supportive, and holistic care throughout the cancer treatment journey. So before I hand over the spotlight to Dr. Sneha, a note to all the participants. If you have questions or queries, you could please leave it in the chat section and we will address it towards the end of the webinar. Welcome, Dr. Sneha, and the spotlight is all yours.
Good morning. Thank you, Mansi, for this wonderful introduction and setting out the platform. And really appreciate you guys joining on a Sunday morning for this knowledge session. So let's go ahead into the topic, that is cancer prevention. Is it a myth or a reality? So why is it important? There is a study that conducted in India, including all the states, and India apparently has the highest rates of cervical, gallbladder, oral, and pharyngeal cancers. And this is not a fact, this is true, because around 1/3 of the global burden, especially in the cervical cancer, is from India. And it is very sad to know that all these cancers can be preventable. As we go through the slides, we can see that. But according to the study, it has been seen that most of the cancers that happens in India predominantly are because of the lifestyle factors, that is tobacco usage, pan masala, and unhygienic processes, and increased usage of processed food items, and not getting vaccinated, especially when there are vaccines available. So before we go ahead, what is cancer? Cancer means that the cells grow out of control. Everything in our body is regulated, be it division, be it growth and all. Suddenly, because of some factor, the cells grow out of control and it is autonomous. That is when they outgrow the normal cells and leads to cancer. So who can get it? Cancer doesn't have any disparity. There is no gender disparity. There is no rich and poor, any language, anybody, even animals, dogs, anybody can get cancer. So what causes cancer? So what causes cancers, in other words, are the risk factors or the cancer causing agents. So we all know that there are some risk factors that lead to the cancer, but whether they can be modified, whether if somebody is exposed to this, are we sure, how much sure that they get cancer, whether they are going to actually increase the individual risk, or may they impact the population altogether for the increased risk. So whenever the cells starts growing out of control, that is predominantly because of the genetic changes that happens inside the cells. These are often seen as the years goes by, because suddenly one change will not lead. Suppose yesterday you are exposed to something that caused some change in the cell, that doesn't mean that tomorrow you are going to get cancer. This has to be like accumulated over a period of years. So that is where the prevention role comes in. And that is also one of the reasons why we see, especially in elderly, more cancers, because because of the over years of accumulation of the genetic changes that happen, and also because of the aging, the repairing mechanisms can go weaker. So what are these changes that happen? So the changes that happens in the genes can be inherited, like our face and all, which are genetic and be inherited from our parents. In the same way, there are some mutations that have that cancer predisposition, but they account only to 5 to 10%. That is where the family history comes in. But remaining errors that happen during the DNA change when the cells grow is predominantly an acquired genetic mutation, may or may not be transferred to the next generation. And most often this is because of the changes that happens in the environment, that is behavioral factors, that can be infective factors or occupational, or it can be medical procedures or exposures. So what are these things? One is modifiable, the other ones are partially modifiable, and some are unmodifiable. Unmodifiables are errors that have happened and are inherited, whereas some are partially modified, that is predominantly usage of growth hormones, or having a healthy lifestyle, whereas in terms of planning a pregnancy, completing the pregnancy, breastfeeding, or exposure to other hormonal agents that can happen, like anabolic steroids, like so. Whereas exogenous ones, these are exposure to the infections or to the radiations, or bad lifestyle habits like smoking, alcohol, sedentary lifestyles. So how anybody can decide this causes cancer and this doesn't? This actually comes from an international agency for cancer research. They divide this individual cancer causing agents into like group 1, which are known to be carcinogenic, like tobacco, alcohol, UV radiation, or probably carcinogenic, like red meat, or plastic, not the one that we use Teflon, but the previous use that is called PFOC agent. Luckily, that is not there in the market now, or possibly carcinogenic, but if they are exposed for a longer time, like hair dyes, where somebody using hair dyes almost every day, like a hairdresser, like that, or arsenic exposure, or lead exposure in paints, or somebody who is working in construction and continuously exposed to the asbestos, like that. And some groups that are group 3, which are not yet classifiable, say like coffee drinking, Teflon usage, plastic wear, they are not yet classified yet because there is not much evidence. And how do they come they to the conclusion that this causes cancer and this doesn't cause cancer? That is basing on the strength of association, that is often called in a medical language called relative risk. Suppose somebody drinks 1 peg of alcohol a day, in comparison to the people who doesn't develop oral cancer, having even 1 peg of alcohol can lead to increase in risk by 1.5. For example, 2 times or 2 pegs sitting, it increases by 2 to 3 times. Like a heavy drinker who drinks at least 5 drinks per day, then the risk grows beyond that, like 5 times. And often when somebody drinks, they're often prone to use tobacco because of the social stress or so. That is not just additive, that multiplies the risk of developing an oral cancer. Similarly, in the breast cancer, the something like which we can't control, like age of menarche, menopause, nulliparity, those are weak associations with the increased risk. But the strong associations include if there is a radiation exposure, or if there is a personal history in terms of like they had some breast lump which has been pre-cancerous, or there is a family history, that means that every generation had breast or ovarian cancers. These are the people with higher risk. So relative risk is basically the strength of association. So of all this, only few have very strong association, while the others, it is a cumulative risk approach. So of all the risk factors that are available in the environment, the most important ones that led to 44% of global cancer deaths, that is 44%, that is almost 50%, are predominantly because of the lifestyle. That is very heartening to see that, because all these can be modifiable. For example, tobacco contributes to 25%, whereas the dietary processed meat usages, red meat, alcohol usage, obesity, and high calories with less fiber diets, air pollution, all these contribute to 44%. So, and if you see that how we can prevent it and why prevention is important before it appears, that is often called primary prevention. That starts when people are very young. That is before they start living their life, start maybe at the younger age itself, trying to give kids a balanced meat, trying to minimize the exposure to automobiles, or less usage of biomass fuels in the family, or getting them vaccinated at the proper age. These all that prevent the event happening, or even the risk of event happening, is called primary prevention. Whereas the secondary prevention is for even recognizing even before they become cancerous, if to figure out the cells whether they have the potential to uh, cause cancer, that is called secondary prevention. That is where the screening or the early detection lies in. And tertiary prevention is somebody unfortunately had a lesion which is probably before has the potential to become cancer, or before it becomes cancerous, and using medications to prevent it from becoming cancerous is called tertiary prevention. So coming to the primary prevention, and of all the most important things, that is tobacco. As you can see, the tobacco causes almost and affects every organ in our body, coming from the eye to the toe. And it causes cancer in the nose, oral cavity, foot pipe, lungs, stomach, kidney, whatnot. It increases the risk of other cancers and also other issues like coronary heart problems, or it even causes stroke and skin, premature aging, all that. So the interesting point, there is a study that was done in Kidwai, that is based out of Bangalore, where they have checked tobacco related cancer cases where they were treating at Kidwai. As you can see, 34% of men cancer are associated with tobacco usage. That is something that can be corrected and can be prevented. The most common cancer that they see among the tobacco users is oral cavity, pharyngeal cancer, that is that when you swallow and it opens to the foot pipe, that is the pharynx. Esophagus is the foot pipe, and the lungs. And coming to the females, 14% of the cancers are linked with tobacco again. Often tobacco users, especially women, they tend to choose tobacco or snuff it. So they often are associated with oral cavity cancers. So stopping tobacco when it starts showing the good effects immediately, because it settles the heart rate in minutes, and even in few days you can see that the blood pressure drops up and heart health becoming healthy in 2 years, and the risk of heart attack comes down in 5 years. And over the period of 10 to 10 years, literally the risk of oral cavity cancers or the oropharynx or even the voice box cancers comes down to 50%, and the chance of lung cancers comes down by stopping it for 10 to 15 years. So what about the newer ones? What about the e-cigarettes? What about the heated tobacco products that we use? That that smoke is also often categorized as tobacco smoke. Even though it doesn't directly fall under the tobacco, there is a chance that it cannot be completely burnt and they are still exposed to that. So they are independently as a risk factor, but compared to it, it is at a lower level. Even the e-cigarettes are not advisable, and they are also major risk because of the toxins that are presented. So the long-term uses has resulted in health risks. So what about alcohol? As I was mentioning before, even a single peg of alcohol, there is no limit for alcohol that is safe, and it is bound to cause one or the other health problems. It need not be cancer, it can be psychiatric issues, it can be liver issues and cardiovascular problems, that is heart, or it can change the behavior into causing injuries, violent behavior, and especially pregnant women or planning to have pregnancy, that can lead to fetal defects. So there is no level of alcohol that is safe. And as we discussed, it also has a summative effect or cumulative effect with tobacco. So the risk of using tobacco is, say, like increases by 5%. Adding alcohol to it increases by 30% the risk of cancers. And alcohol is also associated with cancer of the oral cavity, bowel, breast, liver, voice box, rectum, and food pipe. So how about the sedentary lifestyle? And how it causes predominantly? The sedentary lifestyle predominantly lead to increased in blood sugar and other hormone levels, which results in increased inflammatory markers that can increase the risk of cancer. And it is implicated and is proven that the sedentary lifestyle may increase the risk of breast cancer, colon cancer, and endometrium, along with other heart issues or diabetes. And regular activity, even for the patients who are taking chemotherapy, and activity, moderate intensive activity of at least 150 minutes per week is protective and also even improves the survival. So even cancer patients who are taking treatment can do exercise. What about obesity? Obesity has direct implications in increased risk of breast cancer, gallbladder, endometrium. And again, the obesity is very similar to physical inactivity. It leads to increased levels of inflammatory markers, resulting in endocrine abnormalities, that is hormonal disturbances that lead to uncontrolled cell growth or promoting cell growth that results in cancer. What is the ideal weight, or what is the ideal waist circumference? As per the WHO, 80 centimeters for women, 94 centimeters for men, and the weight adult BMI range has to be in between 18.5 to 24.9. So what are these infections? We see most often people using antacids for years together. For example, I have few family members who have been using pantoprazole for like 20 years, 30 years, without even investigating what is the problem for the gastritis, because of the fear of endoscopy. Endoscopy is hardly 2 minutes, and when they do it, they can check for a bacteria called Helicobacter pylori that can be treated. One, that reduces the gastritis and that avoids the usage of antacids for years together. And this Helicobacter pylori, which is the bacteria often associated with the gastritis, results in increased risk of gastric cancer. And the most importantly, human papillovirus, where the vaccine is available, is implicated in cancers like cervix or oral cavity, anal cancers, penis, vagina. This can also be vaccinated, and by you following a healthy lifestyle, we can prevent the infections also. Healthy lifestyle is not having multiple sexual partners and monogamy and all that. Hepatitis B usually all the kids are vaccinated because it is there in the Indian pediatric guidelines, but the adults were not vaccinated when they were kids. So if you are not vaccinated for hepatitis B, now is the right time to get vaccinated. If you are doubtful whether you got vaccinated for hepatitis B or not, you can always check your titers and ask your physician to check for the titers, and you can get yourself vaccinated. One, that will prevent the liver related infections, and the second, it can also prevent liver cancers. How about diet? What is the best diet? Is it necessary to avoid all the white things like sugar, maida, or is it important to eat only anti-inflammatory diet, increased vitamin C and all? As such, it is important to have a complete meal. There should not, everything has to be moderated. Too much of anything is a problem. So plant-based high fiber diet with less use of red meat, ideally to prevent red meat and processed food items, is a better diet even for your heart or for the diabetes or even for the cancer. And especially the smoked products, usually more often seen in northeast part of India, where they use more coal and more smoked food items. So there is an increased chance of nitrates that can lead to cancer. So how about UV radiation? UV radiation increases the chance of skin cancer, which is melanoma. And we don't usually more often use tanning devices. It is predominantly a Western world practice, but that can lead to increased risk of melanoma and other skin problems, especially for kids. So what are these and how they do? Predominantly melanoma to begin with is not seen in India. The kind of melanoma that we see in India is very different from the Western countries. Luckily, because we are brown skinned people, we have melanin that kind of protects us from the UV radiation. But still, it is important to use sunscreen when you go out, because the continuous inflammation that caused by UV radiation can lead to skin changes that can lead to other issues. So how about environment? Especially in urban cities, because of the usage of more automobiles, more constructions and everything, there is an increased outdoor pollution, which is leading to increased risk of lung cancers, especially in urban areas. That is being not just seen only in one area, it is seen across urban cities of India. And indoor population, predominantly where they use fire or biomass fuels to use, or tobacco exposure predominantly from the secondhand smoking, or exposure to radon. This is more to do with the soil. Some areas, there is an epidemiological study saying that there is increased risk of cancer because of the presence of radon, which is often implicated, say, in Europe and United States for lung cancer. And drinking water, especially the purity of the drinking water is very important. So how about this hormones? We have seen people using hormones, or they say that why don't you use hormone therapies and all. As such, the magnitude of association with the hormonal usage is very less when they are used for a short period, not for like years to put together. But there are some mild things like, age of menarche or late menopause, planning the pregnancies at the correct age, breastfeeding is kind of protective. Planning the pregnancy at the right age is also very important, but some are not modifiable in terms of age of menarche or late menopause. But usage of hormonal contraceptives, there is a transient increase if somebody has already a predilection to the breast cancer, but the long-term association, if they are using for a longer time, is different. But long-term association is also known to reduce ovarian and endometrial cancers. So where it is important, where does the secondary prevention or early detection helps? Because we have seen so many hospitals saying that we'll do cancer screening and all. Where actual cancer screening matters, according to WHO, is cervical cancer, breast cancer, and colorectal cancer. And how do we decide what test to do and what test that they need, who needs extra test, is depending upon the risk. Increased risk, as we seen, because of the presence of risk factors like in terms of family history or previous history of other than cancers, but cancer potential things in the body like polyps or a lump which is not cancerous, but there are some cells which have the potentials. So the cancer screening methods change from person to person, and most often general public without a major family history or without personal history, which is a major medical history, fall under average risk. What about lung? We see more increased lung cancer I'll go into it, but as per WHO, that is still in active research, especially in high risk who have been smoking, or if there is a personal history of prostate cancers, that is where lung cancer or prostate other cancers come in. And predominantly target screening. That is where if somebody is using tobacco or somebody has a genetic predisposition, that is where they come under risk stratified screening. So overall, to say the screening, that is secondary prevention, is proven beneficial in cervical, breast, and colorectal cancers. Why it is important? Because in India especially, as you see in females, breast cancer is the most common cancer that is seen among the Indian women, followed by cervical cancer, followed by ovary. Whereas in males, the most common cancer that we see in India is head and neck cancer, that is more to do with the oral cavity, followed by lung, followed by colorectal and esophagus. So coming to the breast cancer, why it is important? Because there is 1 in 30 chance of getting a breast cancer, and it is the most common cancer in India, and most often because of the stigma associated and not giving enough importance to the lump, even though they observe, because of the fear, they don't come, and they come to a doctor at a very later stage. Imagine diagnosing when the lump is less than 2 centimeters and the cure rates of around 95%, or when they come with completely spread disease in the body with the cure rates of around less than 20%. So what do we do? What do you mean by screening? First thing is being breast aware. That is to begin with a self breast examination. And the next one is a clinical breast examination by a trained specialist, mammogram, or a breast MRI. Breast MRI is predominantly, the doctor will decide who needs a breast MRI with the personal history or with the family history. Mammogram. What is a mammogram? Mammogram is a very simple test. It is based on X-rays, and there is a simple mission that is used to see your breast architecture. If there is any architectural or glandular architecture have changed, then that can be identified. Even the precancerous or the chance of getting cancerous lesions in terms of calcifications can be identified. How well it can detect, whether it has proven beneficial? Yes, it has proven beneficial that it reduces the breast cancer specific mortality of around 30% for aged women of between 50 to 75 years. That is why the screening is very, very important in more than 50 years, especially among women. And how well it can detect it? The specificity rate of the test is 90%. The chance of, if the test identified there is some abnormality, there is a 90% chance that it can be some issue with the breast. The false positive rates are, even though are there, they are very much mindful. The overdiagnosis chance is also very less. So when they do have to start screening after the age of 40, for an average risk individuals, it is individual choice to go for the screening. Sometimes mammogram may not be sufficient alone. We often ask for ultrasound of the breast also, but more than 50 years, mammogram is preferred to be done once in 2 years. So what are the usual symptoms that people present with breast cancer? Most often the breast lumps are painless. It can also be a swelling in the armpit, or it can be a nipple discharge or skin changes on the breast. So how to examine the breast? Anybody can do it after they cross 20 years. So that is standing opposite to the mirror or lying down, keeping the both breasts exposed, and see for any asymmetry, see for any nipple changes. Using the right hand, examine the left breast. Using the left hand, examine the right breast. Start at one point in a clockwise or anti-clockwise motion, and up and down, both as well as lying down posture as well as in standing, and look for these signs. That is any hardening or any pinching of the skin or any erosion or any fluid that is coming out of the nipple on pressing, or any puckering of the skin, the vein which was not there, or nipple changes, or any lump which is not there outside that is visible, but you can feel it, which was not there before. So to summarize, mammogram is a very effective mode of breast cancer screening, and it starts as early as 40 years, and it is important to be breast aware, and self breast examination is very important, but that is not enough. That also has to be accompanied by a mammogram and also by a clinical examination. So coming to the next common cancer, that is cervical cancer, because it is very important, the cancer that can be prevented that contributes to 1/3 of global cases from India. And there is an interesting study that was done in December 2020 by an agency called CAPED. So they have observed that only 18% of the population, they have done it across all the 4 sides of India, and only 18% of population are aware that the cervical cancer is preventable, and 25%, that is very less people are aware that it can be detected very early before even it becomes cancerous. So this happened a little like 2020, but 2024, our Indian Parliament, our finance minister, luckily, and that's a very good thing that she has done. She launched an Indian-based vaccine, that is Servavac, at an affordable price. Why it is important? Because the Servavac protects against 6, 11, 16, 18. These are the variants of HPV virus. It is a virus that infects, but in some people it is found that the HPV virus is going to stay dormant in the cell lines, and it results in growth. It promotes cell growth and making the cell continuously to secrete inflammatory markers that kind of acts as green signal, and the cells start growing out of control, resulting in cervical cancer. This HPV vaccine prevents this latent infection that is caused, and of all this, around 16 and 18 are constitutes around 80% of the cervical cancers. So these two vaccines, that is Servavac and Gardasil 9, are very much available in India. As I was mentioning, Servavac is by the Indian government, whereas the Gardasil 9 is an imported vaccine by MSD. It also covers other high risk viruses that causes genital warts, and the efficacy of this vaccines are more than 90%. So when to start vaccination? So the vaccination is approved in both girls and boys. The ideal age to get vaccination is after they cross 10 years, before 15 years. It is usually given as 2 doses, 6 months apart. More than 15 years, it is 3 doses. First vaccine is given, suppose at a 0 month, the second vaccine is given 2 months later, and the third vaccine is given 6 months later. It is important for both men and women to get vaccinated. So how about people who are already married or they had a kid? Is it okay to get vaccinated? That is the most common question that we come across. Yes, it is, because our Indian practice is monogamy predominantly. So the chance of exposure to the high-risk viruses is very less. So according to the Indian guidelines, and especially with the Servavax, anybody can get vaccinated up to the age of 45 years. But as I was mentioning, it is most efficacious when it was given at the correct age or before their first sexual exposure. So what other cancers it can prevent, or other infections that can prevent? HPV vaccine is protective against other cancers like anal cancers, oropharyngeal cancers in the throat, and it can also prevent genital warts. So how about somebody got vaccinated, whether it is important for them to go for screening or not, or whether it is screening available for cervical cancer? Yes, the screening is a very simple test. It's a pap smear. It is a painless OPD based procedure where they just take a swab of the mucus that is there around the cervix and they send it for the testing. This even detects cells which have the potential to become cancerous, that even before the cancer appears, there is a chance we can detect it and treat it so that the cancer will not happen at all. So that is called pap test. And when it should be done? As soon as they become sexually active, ideally cervical cancer screening starts, and it is with the help of, if at all we are doing only with the help of pap test, it is once in 3 years. Yearly screening for cervical cancer is not necessary. Even though you are vaccinated, it is important to follow the vaccination schedule. Even if you are vaccinated, it is also important to follow the screening schedule, that is pap smear and HPV testing together. HPV testing, even though we do it regularly, very often we see people not doing it. What is HPV testing along with pap smear is that in that test, we will test for the virus, that is HPV viruses, which is implicated in the cervical cancer. That is seen, the association is seen in more than 90%. Suppose if somebody is positive for HPV, then the screening slightly changes. According to the physician, probably the screening may not be once in 3 years, probably an year later they need to repeat it, and they may have to go for colposcopy, that is seeing the cervix under a camera. So it is better that we do pap testing along with HPV testing. Even if a pap smear along with HPV testing, if you do it, you don't have to repeat the test for 5 years. If the pap test is done alone, that is pap smear, then it has to be done once in 3 years. So what are the symptoms of cervical cancer? Often they present with intermenstrual bleeding or change in the vaginal discharge, recurrent urinary tract infections along with vaginal discharge, sudden swelling of one leg or some constipation or changed bowel habits, along with the foul smelling discharge or pain during sex or low back pain that is continuous associated with vaginal discharge. So these are the symptoms that indicate that they need to be checked by a gynecologist. So colon cancer, this is the most common cancer that we see, especially in the Western world. It is the second common cancer that they see, but in India, it is the fifth most common one, and it is seen after the age of 50 years, especially with the family history the family history of colon cancer or the breast cancer. It increases the risk of colon cancer also. So they can get, if somebody has a first degree relative, the screening starts little early. We see a rising trend of colon cancer, especially in Indian population, because of the changed dietary habits. What is there any screening test available? Yes, there are multiple screening tests that are available. To begin with, it is a simple stool test for the occult blood. If that is positive, that has to be often accompanied by an endoscopy, which is often done once in 10 years. Or even a simple CT scan that can be done once in 5 years is a good screening test. So what is this colonoscopy? Why is it so scary? Is because one, the fear of it, that it is a painful one that requires sedation, that requires hospitalization, but it is the gold standard test for somebody who crossed 50 to detect even the potential of cells who have potential to grow into cancer, like simple polyp. It can just be anemia, that they have recurrent iron deficiency anemia more than 50. It is not just anemia because of the iron deficiency. We need to see whether there is any chance that they are bleeding out from the gut, which is not seen in the normal stool. So colonoscopy is the gold standard. It is a painless procedure. It is the only test that kind of even pick up lesions which have the potential to become cancerous, and also the lesions that may not become cancerous, but often has to be treated for the normal things like anemia correction. So what are the symptoms? Often colon symptoms are very vague symptoms. It can be just diarrhea, or it can be the reduced stool quantity, or often blood in the stool, or pain abdomen, or recurrent anemia. In spite of doing iron correction, they tend to have anemia, and again continuous fatigue or weakness because of that, and cramping abdominal pain that is always persistent, often associated with vomiting. Coming to the head and neck cancer, same like cervical cancer, India has a very high burden of head and neck cancers. Often this is because of the tobacco usage that is seen among men and women. It is the most common cancer among men in India. So unfortunately, there is no blood test or saliva test that is proven to detect head and neck cancer. It is predominantly a routine physical examination or a screening. What are the signs? When to visit a doctor? If there is an ulcer which is not healing, or it bleeds on touch, or it is a red color or a white colored patch that has come, which was not there, but it is persistent, or if there are difficulty in opening the mouth, or if there is a persistent pain in the mouth, or difficulty in chewing, or difficulty in moving the tongue, it is important to visit a doctor. What to see when you do a routine physical examination? To look for these: look for any color change, feel for any hard which is not there, or the numbness areas, any white patches on the gums, or if there is any soreness or loose tooth, or tooth with a swelling or ulcers, or if the tongue movement, whether the tongue movement is fine or not, whether the edges of the tongue are smooth or not, whether any new patches or ulcers have come which have not been healing. That includes lip, gums, cheek, tongue, roof of the mouth, and the floor of the mouth. The second most common cancer that is often associated with tobacco usage is lung cancer. 80% of the lung cancers are because of the tobacco usage. So stopping tobacco can prevent that many amount of cancers. That is something that is very, very important. Why is it important for us? Because in Bangalore, it is the most common cancer seen, especially in men, more than oral cavity cancers. So what is the screening? As of now, the guidelines recommend lung cancer screening with the help of a low dose CT scan. That is a CT scan of the lungs, which can be done once a year for people between the ages of 50 to 80 who are currently smokers, or who have smoked previously for 15 years, or who had at least have an history of smoking for 20 pack years. That is number of packs per day into number of years, if it equals to 20 pack years. So, but in India, because of the biomass usage, or because of the increased population who had exposure to tuberculosis or increased COPD, the expert recommendations are there, but there are no per se Indian guidelines for it. Somebody more than 40 years of age with a red flag symptoms like persistent cough for more than 3 weeks, or who is a smoker, who have been exposed to the biomass fuels for at least 20 years, or if there is a first degree relative with a lung cancer, they can opt for lung screening with the help of a low dose CT scan. Coming to the prostate cancer, most often we see we can do serum PSA for men, but it is important to do the test. There are some caveats to checking for it, which I will be explaining to you. Prostate cancer is one of the top 10 cancers among men in India. It is often second most commonly diagnosed in urban cities, following lung cancer. So what is the problem of checking serum PSA that you should be aware of? It can lead to a overdiagnosis. Sometimes it is not necessary to treat prostate cancer, especially in elderly in with multiple comorbidities. Most often we see prostate cancer above age of 60, and often people with more than 70 or 75, they tend to have other health issues in terms of heart or neurological problems, where it is not necessary to treat prostate cancer. So there is always a risk of overdiagnosing it and subjecting them to unnecessary biopsies. So per se, serum PSA is not recommended by WHO for prostate cancer screening for everyone. But somebody who is well informed and more than 50, they can do one serum PSA. If it is normal, then they just have to repeat it after 5 years. Suppose if it is slightly abnormal, probably they can repeat it after 2 to 4 years. More than 60, definitely if the PSA is normal, they don't really have to follow up with any of the PSA reports. But if it is abnormal, then we need to risk stratify and do the needful. So more than 50, if you are willing, you can definitely do a PSA testing, and if it is normal, you don't have to worry about PSA for the next 5 years. But somebody who had a family history of prostate cancers, or with a family member who is having a breast cancer and detected to have hereditary gene that is implicated in the cancer, it is important to start screening early with serum PSA. Only the blood test is not enough. It is often accompanied by a digital rectal examination by a trained physician. And sometimes MRI may also be necessary. So there are any tests with newer things that are coming? Is there any single test that can detect multiple cancers, like any screening like a mammogram? There are few multi-cancer detection assays that are coming up, but they are not in the guidelines yet, because these are not only the screening modalities that have proven only the beneficial. Always they have to be accompanied by further testing. They are still in the clinical trial stage. Hopefully, if we get it in future, that is very helpful, especially in high risk population or people who are exposed to multiple outdoor pollutants or occupational hazards. But as of now, there is no FDA approved multi-cancer detection assays. That means there is no single test that helps us to, in the screening, to detect or even the chance of getting cancer at a later state. So to summarize, screening as per WHO is effective predominantly in 3 cancers: that is breast cancer, cervical cancer, and colon cancer. The other lung cancer and prostate cancer are predominantly basing on the risk groups. And the most important preventive measures, the whole point of all this is we can decrease the chance of getting cancer by at least 30% by maintaining a healthy lifestyle. That means limiting alcohol or not using alcohol, preferably avoiding processed foods, maintaining a healthy weight, exercise, whole meals, avoiding as much as other supplements as possible, and being physically active and following the screening protocols. And most importantly, avoiding tobacco completely. And the screening, it starts at the age as soon as the people become sexually active, especially among women for cervical cancer, that is after they are 25. And for women who crossed 40, it is breast cancer screening with a mammogram, and cervical cancer screening with pap smear with or without HPV testing. And for men more than 50 and more than 45, colon screening, preferably with colonoscopy once in 10 years, or at least a stool examination for occult blood, which is often available. The kits are even available on Amazon to get it done. So it is an yearly test. If at all they are positive, then followed by a colonoscopy. So when to visit a doctor, especially if there is an ulcer which is not healing, or if there is a bleeding, which is, it can be just, bleeding from the rectum, often seen as piles, or it can just be seen as a fissure, but it is important to be get it checked. Unexplained weight loss, difficulty in swallowing, any lumps in the body which are not there but are now are there, cough which is not going down for more than 3 weeks, or change in bowel habits. So what are the common myths that are associated with cancer and its treatment? Chemotherapy, my mother or father are emotionally weak, they may not be able to tolerate chemotherapy. That is false, because there is no association with the mental health and the cancer treatment. Both are very different. Yes, they have to be strong, but that doesn't mean that they cannot tolerate chemotherapy. And more than 60 means already more than 60 and they are diabetic, they may not tolerate therapy. That is also wrong. Age is just a number. It is more to do with their physical fitness, how physically fit they are. And they cannot return to normal activities is also wrong. Even with the development of the newer medications, the chemotherapy is well tolerated. The thing that has changed the cancer treatment is most importantly making the treatment tolerable. What we see in the movies, carrying a bucket or not able to carry out their activity, is not seen now because of the very effective antiemetics that are available. There are even techniques to prevent the hair fall during the chemotherapy. So there will not be any major permanent damage in terms of them returning to normal activities. They would be able to continue their normal activities, especially with less intensive chemotherapies, even during the chemotherapy. How about using yoga and all? If it is helping with the mental peace, definitely doing yoga is helpful. Maintaining the physical activity is very much important, and it is proven beneficial even during the chemotherapy. Ayurveda, what about Ayurveda or Unani medicine? Most often they use plant-based product which may even contain chemotherapy that is in an unregulated dosing. So we don't know about the interactions between Ayurvedic medications and the cancer medication. Sometimes the toxicity also can increase. So it is important to let your physician know that you are using these products. Cancer is not curable and it is not the treatment. Even for example, stage 4 lung cancer previously was seen like, the survival is less than 1 year. We are able to see survival with the advent of newer targets therapies, which are just oral tablets, that beyond 3 years, even beyond 5 years. So and most importantly, if the cancer is diagnosed early, that means as you visit a doctor as soon as there is a problem, and if it is detected very early, then it is curable in more than 90% of the patients. It is contagious. It is important to isolate them. No, cancer is not contagious. And what caused my cancer? Unfortunately, there is no one single answer what caused it. And at the same time, there is no single test yet to detect cancer. If there is no family history, means no cancer. Again, family history contributes only to 5 to 10%. And predominantly it is the lifestyle factors that contributes more than the family history. No family history, that doesn't mean that no cancer is a false thing. And it happens only in elderly? No, the cancer can happen at any age. It most often, there is no specific region, but definitely we often see cancers, that blood cancer, which is more commonly seen among kids, is completely curable. And even teenage also, there are certain number of cancers that happen which are often curable. So 20 or 30 or even 35 or 40, any age group who persistently have a symptom which is not getting solved, it is important to get it evaluated by a trained physician. So most importantly for everyone, how to be a caregiver, the most important problem now is because of the knowledge vomit from the social media or because of the AIs or chat GPT. Everybody is a doctor, but it is important to know that you are always a part of a team. It is important to support your family member rather than being a doctor for them. So it is important to be organized in what are the reports, what are they due for, what testing to be done, being proactive in terms of, suppose if they have a pain or if there is a fever, immediately to rush to the doctor rather than treating with the help of Google. And there are some limitations, nobody is perfect, there is limitations, and we are humans at the end of the day. It is impossible to accept when we see there are no limits for the treatment, no limits. No, there are limits, we are humans, we can do at certain point. Even you are a human being and you have a life, you have certain limitations for yourself. Accept the limitations and try to get help and support from other people around you or your doctor or their team. And most importantly, it is important to look after yourself. Or if somebody in family or distant relative had cancer or a chronic health problem, even it can be a heart attack or something, it is important to maintain the normalcy rather than forwarding the WhatsApp forwards, do this and do that. So this is how I think that the how caregiver should be there. So thank you for giving me the opportunity. Now the platform is open for questions if somebody has any questions.
Doctor, we have a couple of questions that's come in the chat box. Let me just take it up one by one. We have Maitreya K who's asked, these days there are a lot of messaging on organically grown food. How valid is that?
Predominantly that is because of the pesticide usage that they were coming up with. The organic food usage is better, but as such there is no proven data that organic food is better than the other one. It is important to have an healthy meal that includes all the vegetables and high fiber, and probably cleaning the vegetables whatever that come. There is no specific say that, like, organic food is better than the other or a study to prove it.
Another question that Haridas PV has asked is, hot food being delivered in plastic containers, use of paper cups for hot tea, coffee, use of microwave for heating food. Are these harmful and will it cause cancer?
So plastic containers, especially if they are used more often in regular day activity, which are old. As of now, there is PFOC, that is octanoic acid containing plastic, which has already been banned. But there are some areas where they are still using it, but the quantity of it may be much less. But as we don't know, there is no regulation on the plastic products that are available in our market. Preferably it is better to go with a better quality one. The Teflon as such, as at this point, has no implication or a study to prove it that it is cancerous. But randomly cheap plastic products, we don't know the content of it and how much amount of this harmful material that we are exposed to. So I would say avoid plastic if possible, because there is no regulation for that. And coming to the microwave, it is more to do, these are not UV rays, so they are safe. And paper cups, more to do with the dust that is there on the paper cups. I think if you can clean your paper cup properly, that should be okay.
Thank you, Doctor. There's another question by Maitreya K. What about the use of protein supplements? We've heard that people into protein supplements get into kidney issues. I'm thinking it's something to do with kidney cancer that they're asking about.
Not necessarily, not proven that it increases the risk of kidney cancers.
Interesting. Doctor, I think we've covered most of the things that has been, and it's been like an extensive presentation. So we have a couple of questions still coming in. How accurate are the tests like CEA, antigen, to identify symptoms or possibility of getting cancer? This has been asked by Sai Nadimendi.
They are tumor markers. Tumor markers are very sensitive, and they're often are elevated seen in other conditions. There are multiple conditions, say like CA-125, which we commonly associate with ovarian cancer, is often seen is even raised in cases of like gastritis or endometriosis. It is impossible to differentiate what caused what. So they are not often the only test as a part of screening. They should always have to be accompanied by something else. So, let alone only these tests are not good screening modality.
Doctor, a couple of very questions. I'm just picking this up from the internet as well, and a couple of your patients have also asked us, why cancer now? Why do we see like an increasing risk of cancer now? This was unheard of 15, 20 years ago. It's only in the last decade that it's mushrooming like crazy. We've got kids with cancer now with no history, genetic history at all. So why is this mushrooming at this level?
Predominantly, one thing, thanks to our availability of medical services that is there, we are getting better in treating the infectious diseases. We are able to see more people living. See, when we see predominantly 100 people, if somebody has got first rank or the second rank, we tend to remember only first and second rank, and the remaining more than 50 ranks are often gone. So previously, because of the infections, we are losing more number of people, which we are able to fight well now because of the availability of medical services. And more importantly, previously, somebody has a heart attack. Now it is somebody has an heart attack, they got an angioplasty. So we are able to control betterly other issues. So people tend to live longer, and at the same time we are also having good diagnostic facilities. Everybody, I'm sure everybody who are there have already has gotten a health screening at least done. So the chance of picking up is also getting more. So one, people are living longer, and second, the medical facilities have gone up and the pickup rates have gone up. And coming to the childhood malignancies, it is very difficult to say at this point. Now it has risen. Childhood malignancies were always there, but more awareness has come. But more lifestyle associated factors are contributing. Probably we will be seeing in the next decade where the cancer, especially we see in younger people, will start go up. Younger in the sense, usually cancer is seen beyond 60 or beyond 70, where we see more accumulation of the factors. But with the tobacco usage and the alcohol, which has become the new lifestyle among the younger generation, probably in future, this is all accumulation. So it is important to act now than later. So yeah, more to do with better medical facilities, better availabilities, and lifestyle.
Interesting and scary. So, Doctor, we're looking at so many tests, right? And then we have social media, we have got digital screenings and all of that telling us that, go through this test, go through that test. So you've already covered what tests to look at and who should be doing it. But quickly, if you could tell us, when should we get this done? Who should get this done? Then it will be great.
So as soon as, for women and men separately, for women, as soon as they become sexually active, one is cervical cancer screening with the help of pap smear, and after they cross 40, at least once a mammogram between the ages of 40 to 45. More than 45 years, mammogram, and at least once in 2 years. And after 50, again once in 2 years, mammogram. And anybody, both men and women, more than 45, colonoscopy once in 10 years. These are proven that they detect very early, and even it helps in reducing the cancer related deaths. And somebody who is a smoker or who has been exposed to the dust more often than they can imagine, or somebody who has using biomass fuels in the house, then they come under high risk group, especially for the lung cancer. That is a low dose CT scan done every year after they cross 50.
Got it, doctor. Um, That's a very interesting question. Why men should be well informed about breast cancer?
So that they can encourage women around you to self examine and to visit a doctor for the screening. And men often can develop breast cancer if there is a family history of breast cancer in the family. So men also have a breast issue. More often it is associated with the family history. So somebody who has more than 60 men, if they have a heart tissue around the nipple, that needs to be evaluated. Men are also prone to get breast cancer.
Doctor, one staggering questions when it comes to money, right? We see that, it's the screenings that are being happening and all of that. A lot of people go by the digital bit when somebody says, get your 15 tests of cancer in one go, right? We're looking at the money part of it, you just go get it screened and all of that. Now, these are people who are still not being diagnosed, or, they come back like 3 years, 5 years later being diagnosed with cancer. What is your take on this? A lot of things mushrooming on, tests that are happening.
A screening is predominantly when somebody has no symptoms. They are for healthy people to begin with. And somebody has, say, like, breast lump, and they go for screening. That is not screening because they have a breast lump, and which is the reason why they are going for a doctor examination. So, screening is for people who are absolutely healthy and no symptoms to begin with. That is first to begin with. And multiple tests to do for the screening. Even there are some AA platforms who have been doing all this, but at the end of the day they accumulate all this without any risk factors. They have basically breast mammogram, they have a pap smear, they have a low dose CT scan, they have a CT scan of the abdomen. These are already there as a part of the screening modalities that have been approved by WHO and also by ICMR guidelines. It is just part of all these tests. More than to that, they add few blood tests like CA125 and CE and all to increase it. So there is no specific new AI based test. What are the tests that are available? They combine and they do it. But at the same time, after 3 years, why they are able to recognize it? Most often when they combine this test and they do as a package of multiple times, we see a mission reading thing. So when there is a mission reading thing, it is more like an algorithm that is picking up. So there are other things also that they make the mission learn. Say like what is a risk factor. Say like 20 years is going getting at a screening for 15 tests. Even if they have a lump, sometimes the mission cannot recognize they are 20, because at 20 the chance of getting breast cancer is very less if there is no family history. So there are some caveats under it, which is why probably in especially AI based digital thing, they are still upcoming, they are not there yet, but it is often have to be accompanied by a specialist examining the test at this point of the time, so the missing rates can go low.
Interesting. If any of you here have questions, please leave it in our chat section. Moving on to the next set of questions that are commonly asked from the patients is, you've covered very less on the caregivers, about 1 or 2 slides on, them being a part of the team. But who's going to take care of the caregivers? Because patient, everybody is looking after them, but caregivers are very scared. Is it communicable? Apart from cancer, during cancer treatment, is there anything else communicable? These are the questions.
uh, One thing, being caregiver is not something everybody is trained for. Being a patient, at least they are going through something and the enough care is given to them. Being caregiver is definitely a tough job, and it is important to find support, even be it a medical group or medical help, or there are even associations. Even for that matter, Spashta, we are also coming up with a caregiver group where we support the caregivers how to take care of themselves first so that they can take care of the patients in a better way. That is one. And being the communicable part, if somebody is undergoing, say, like chemotherapy, they don't give any infection to the people around. It is more to do with the people around. Say, like, a normal cold for a normal person can become a pneumonia for a patient who is on chemotherapy. So it is important to look out for the symptoms of fever and get a medical examination done rather than treating it at home. So being caregiver is one, being taking care of yourself and asking for help, and most importantly, being proactive in getting the medical attention.
Doctor, one dire question. Let's say there's a person who's been diagnosed with cancer. How do they choose their doctor and how do they choose their hospital?
Somebody diagnosed with cancer, choosing the doctor is basically predominantly an individual preference. I would definitely say that, it is the same protocols that everybody follows across the globe, even in all parts of Bangalore or all parts of the country or in India and US. There is no medication that is not available in India per se that is enough to treat the cancer. It is more to do with the confidence that the patient and doctor relationship have, more to do with it rather than to do with anything more.
I think this is a question from people who have no clue about healthcare, like never exposed to hospitals. Suddenly there is a pain, and then they go ahead and they get the test done, and it says cancer. What is the best way to look for doctors and hospitals?
Uh, First thing, if somebody is diagnosed with the cancer, I think they might have already met the doctor already. Otherwise, it is impossible to get the diagnosis done. And most often, who they have met, they will direct them how to go forward. And what I can suggest from the other side of the table is that first, don't panic. We can always find a solution. Panicking and asking everyone and like searching for the Google what to do and all, it is impossible to even digest the fact that one of your family member has been diagnosed with cancer. First, rather than searching and this thing, be calm, and definitely you can have a conversation with who has spoken to you about this diagnosis, and to plan things out, how to meet it, what to expect, what. So normally when a patient comes to us, predominantly what we expect the patient to be is predominantly when they go out of our room, they should be well informed. First, what do they mean by getting cancer? What is the stage of the cancer, and what are the treatment implications that are available, and how to choose? So, as a doctor, I would like my patients to make a well informed choice and help them to choose between the choices that they have. So similarly, when they walk in, rather than bombarding with the question, or always with this intent of, probably they are not saying the right thing, probably if there is somebody else who will say the right thing, it is more to do with they want an answer which they want and we are not giving it. So that is very tricky point that leads to more confusion rather than helping the patient. So it is better to have an open mind, and you can always discuss with the doctors what else can be done, what are the other choices, rather than always in the defensive and offensive mode whenever they meet a doctor.
All right. So many testimonials on social media by well-known celebrities in the Western world about the shots and medications which are combination of fermendazole usage that has worked for them, even though they have been told they have only a couple of days or months left. Any thoughts on this?
Not that I know of, and not that it has enough data to back it up scientific, I mean.
Interesting. I think those are the questions that has mostly been answered. Doctor, yesterday or day before, there was a study that was released, which has triggered a surge of searches, actually, something to do with vitamin and cancer immune system, vitamin A and cancer immune system. Do you have any comments on that? Does vitamin A interfere with cancer treatments?
No. Too much vitamin A is a fat soluble vitamin. Okay, and more of vitamin A is also dangerous. Same like vitamin D. We have seen people have taken vitamin D every day. So these are all fat soluble vitamins. There should be a caution when they are taking it. Too much of anything is not warranted, and especially to do with vitamin A, D, E, K. These are all fat soluble that has to be prescribed by the doctor, not to be taken alone. But per se, there is no direct interaction between vitamin A and cancer. But at this point, I can say that there is protective role, very less, like the relative risk is very less. Association is also very less, but vitamin D and calcium helps with the colon cancer. Mansi, you're on mute.
All right, with that, if nobody has any more questions, we've come to the end of the session. So, Doctor, do you have any parting thoughts for all the participants here? And because this is a recorded session, we will have this going out to the world as well. So, any parting thoughts on anybody who's watching this? It could be the first time they're even listening and thinking about cancer.
Yeah. First, I really appreciate you taking the time out on a Sunday morning to listening such a long session, and I hope that this is useful, or at least there is a scientific backup to what you hear now, and you can put it across to other people in a better way. And now now you know that about how to prevent it and all, and if you can encourage people to get at least vaccination against HPV, it is definitely helpful, and it is, we can prevent a cancer. That is something that I can live with, if I can encourage at least if one person to get vaccinated if they are not. So try to encourage people if they are not vaccinated for HPV. And screening is not something for somebody who had a trouble, and screening starts at the age of 45. It is important to get it screened. Don't ignore what your body is telling you for a long time. If you have any symptom for more than 2 weeks, please visit a doctor who is trained, not some a local person, or Google, who is telling you to take this medication and that medication.
All right, with that, we come to the end of this session. I would like to thank Dr. Sneha Kommineni for having been the resource person for this. She is a leading medical oncologist, and she's been practicing this for over a decade now. She is extensively experienced in diagnosing and treating a wide range of cancers and committed to delivering evidence-based personalized cancer to each patient. I would like to also thank Dr. Varun, Dr. Praneeth, Dr. Kirtana, and Dr. Shravani for supporting us in this as a part of Spashta Healthcare. And Vamshi, if you're here, one of the directors of Spashta Healthcare, thank you so much for all the support. And Sipla, thank you so much for giving us this platform to put all of this together. With that, we come to the end of the session. All of you who are here and who are seeing this, you can get in touch with Spashta Healthcare by getting into our social media handles, which is Spashta Healthcare. We are across all social media, so please do come and query us on any doubts, any clarifications you need. There's also a number in our social media channels. You could use that on WhatsApp to give us your queries. We are situated at Pulimavu of Bannerghatta Road near BTM Layout. You can always drop into Spashta Healthcare with your queries if you have any. Thank you so much for listening. With that, we come to the end of the session. Thank you all.